tell us why the emergency room is not the place they should enter, and why primary care is so important.
Well, I think it is a challenge in terms of primary care for a lot of Hispanics, mainly because some may actually not come from a healthcare system in their own countries where primary care is a priority. A lot of people are used to seeking care for when they're sick only rather than preventative care. It is so important to have a primary care physician and not utilize the emergency room, for one, because it can be very expensive to go to the emergency room, where someone who's not familiar with your health issues can initiate a workup that can get expensive very, very fast. Whereas if you have a primary care provider who knows you, who knows all of your health care issues, and can take your concerns in that context, can institute a plan of care that is more financially conscious to you, and also more tailored to what you may actually need, rather than just sort of doing a broad set of tests. And it's also someone that you can follow up with for preventative care, to prevent you from needing emergency care by going to someone on a routine basis.
Okay, thank you very much. Now, we know that Fairhaven Health Clinic, one of the places that people get good primary care, one of the places that people get good comprehensive care. And that's why I'm so glad that you're all here, because I have visited your clinic on more than one occasion, and I don't know how you guys do it, but you have hundreds of people all the time, and they're moving through. It's just that they keep coming. They're moving through. Yvette, you're the operations manager for the clinic. Tell us why Fairhaven Health Clinic is so important to the community, for one, but why it's particularly so important to Hispanics, Latinos.
Well, just to piggyback a little bit what Dr. Garcia was saying, is that for a lot of Hispanics, especially for undocumented and not born, the community health centers is that catch-all, and we don't deny care, and that's why it's so important to try to get your services at any primary care center. But at a community health center, you don't need to be afraid that you are not going to be able to pay for your services, that you're going to be denied any care. You're not. You're always going to be offered all of the care at the primary care center, as well as programs. So why Fairhaven Community Health Center? As you saw, we see anywhere between 500 to 1,000 patients. And then they're coming in and they're moving along. I think it's we provide very good care. We provide comprehensive primary care, and we know that we have to collaborate along with Yale New Haven Hospital, St. Raphael's, so that they could also get specialty care. And we've done that by programs such as our point-to-access care, so trying to collaborate with community providers so that our patients can not only get their primary care services, but also specialty services that they need. So,
and tell us a little bit. I think the Fairhaven Clinic started back in 1972.
Yes, it did.
So it's almost
we're celebrating our 40 years. So we started our 40-year celebration.
Wow, you started.
Yes, we do. We see about 75,000 visits a year.
Oh my goodness. Yes. You know, I shudder to think what would have happened if you guys weren't there. You know, it's because for the fact that someone can come there, whether they have health insurance or not, and get care, and get comprehensive care, is just so remarkable. Now, you're a pediatric nurse, so you start with the babies.
Yes.
And then we have Paula, who is at the K-8 school. Now, tell us, I know you have 5 school-based health clinics. Yes, tell us what schools they're in.
Well, our school-based health centers are at Clinton Avenue School-based.
Clinton Avenue,
yes, that's
which
where
is
I am.
in Fairhaven.
Yes.
Yes. And that's a pre-K-8 school?
K through 8.
K through 8, yes.
John S. Martinez, Wilbercross High School, Riverside Academy,
Fairhaven
K through 8.
Yes, okay. So we have Clinton Avenue, Fairhaven, John S. Martinez, Riverside Academy, and Wilbercross High. Yes. So we have 2 high schools and 3 K through 8.
Yes.
And what goes on at the school-based health clinic?
Well, we have a lot of services that we offer to the students. Anything from an earache to physicals for entry into the school, sports physicals, immunizations, reproductive health. We can also address. So we can do pretty much everything, a lot of things.
That a full-scope primary care.
Exactly, that a primary care office can do. We can do.
And do they have to have health insurance at the school-based health clinic?
No, all we ask is that they register with us, that the parents give us permission to see the child.
Yes. So the Board of Ed has a registration.
Yes, they have a registration form.
And we ask that we send them home at the beginning of the year, and we ask that the parents please sign so that they understand, and they can opt out of some services if they'd like.
Yes.
But once you sign this registration form, when you go in kindergarten, it goes up until you graduate, till 12th grade. You don't have to re-sign it again. But it helps you, it provides you with all the services so that if you do need episodic care, urgent care, you can get that care if your school has a school-based health
And
center.
you can get what I like about this is that you don't have to leave school and go to the emergency room, or they get comprehensive care right there.
The parents don't have to miss a day of work. They can call me in the morning and say, my child has an earache, can you please check it? And I can check them. They don't have to miss school. If they need to be treated, we can treat them.
Wow. Now, what about, we're in these 5 schools, but I know that in Fairhaven area there are other schools. You know, there's the Ross School,
Columbus.
There's Columbus Family Academy. If a child at Columbus is ill, can they come over to your school?
No, so what we do provide, though, is any student at any of our school-based health centers, if they have siblings and or their parents are young enough, and we can treat up to, as pediatric nurse practitioners, up to 23 years old, then we'll see the family. You know, they don't have to go to the school. If, let's say, somebody, one of the students at the school is sick and they have a younger sibling and the parent just wants to bring them all together, we'll see them all at the school-based health center. And then you also don't have to be part of the catchment area. For example, for Fairhaven Community Health Center, if you are a student at one of our school-based health centers, you automatically can go to Fairhaven Community Health Center and be seen. In a school like Columbus, it's called a community link, so that if, because they don't have school-based health center there, but the nurse has the ability to call over and say, look, I have one of our kids here who are sick, can you please see them? And we try to provide those services,
And
but we don't
Columbus
actually have a school-based health center there. So,
But Columbus School is a Columbus Family Academy or something.
Yes,
So that means that family members can go to the school for other concerns and share those concerns.
I don't know about Columbus because they don't have school-based health center. And by the way, Fairhaven started at Columbus. I don't know if you know that. It was a little really like Columbus school. Yes.
Wow.
But anyway, no. But at any of the school-based health centers, we'll see the family there. As long as one of them goes to the school, we will continue to see their entire family.